to you, Roxie. Thank you.
Thank you. So what an NSWAC is, if you're curious, is a nurse specialized in wound ostomy incontinence. We used to be referred to as an ET nurse, and everyone always thought that we were just strictly ostomy nurses, but we've always had the three components to our education. So this is me. So it looks like I have a lot to do in the agenda, but it's only 1 or 2 slides per topic, so don't get upset or worried about it. I don't have any conflicts of interest, and this knowledge is taken mostly from my practice. So a urinary diversion is necessary when the bladder fails to store or eliminate urine effectively due to the various medical conditions. Conditions necessitating urinary diversion: bladder cancer, neurogenic bladder conditions, something like MS, Parkinson's, spina bifida, and bladder damage from surgery or injury. And I even met someone who had radiation damage from radiation and had to have a little conduit. So there are a lot of reasons a person can get a bladder or urinary diversion. So I know that Christina and Dr. Schlegen have talked about the different types of urinary diversions. The Indiana pouch is a surgical option, and you can see on the diagram, it is a pouch made from your small intestine, and it holds urine. You have to self-catheterize in order to get the urine out every few hours. The benefit of the Indiana pouch: it's a surgically constructed reservoir designed to hold urine. The pouch enables the storage and drainage of urine, offering patients a dependable alternative to conventional bladder management techniques. An intermittent catheter is used to access the pouch throughout the day to void. Everyone know what an intermittent catheter is? Who can benefit? The Indiana pouch is especially appropriate for individuals who need bladder replacement because of different medical issues. And like Dr. Shea said, with the neobladder and the Indiana pouch, there is a lot of criteria that is probably discussed before considering these two options. So quality of life, there's significant improvement in quality of life. Continence control, they do experience better continence, leading to increased confidence and social participation. There is a risk for complications such as infections, which can arise from improper catheter use. And there's a cost involved as well. It's kind of one of those hidden things. Intermittent catheters do cost. They're not reusable. It is not best practice. So you would be using a new catheter every time that you are catheterizing. A neobladder is created by using a segment of intestine to replace the bladder, allowing for a more natural urinary process. Post-operative monitoring is crucial. I think this has already been said. A notable benefit is the ability to urinate naturally, which can significantly improve the quality of life for individuals. There are complications, though, such as persistent urinary incontinence that can occur following procedure. Part of the process is you have to build volume in this neobladder. You want to build it so it can hold 300 milliliters of urine. And this process does take time. So it begins with consuming 8 hours every 2 hours and then voiding every 2 hours. And this will gradually enlarge the volume of the neobladder until you can go 3 or 4 hours through the day. without voiding. Through the nighttime, it may take longer to become continent because you are asleep and not as aware of the need to void. Also, the sensation of to void is different as well because we don't have the nerves in our urethra, in our bladder that are there. Everything has changed, so you have to become used to the new sensation of needing to void or the feeling of pressure in your abdomen. An ileal conduit. I'm thinking most people here have or are getting one. So we all know it redirects urine by utilizing a portion of the small intestine to connect the ureters. And this allows the urine to come to the surface. And you can see in the diagram how the ureters are attached to the small intestine. It is usually on the right side because the right ureter is longer than the left. Indications, usually cancer, a severe injury, radiation. Post-surgery, proper care of the stoma is essential for hygiene and health, and it does impact quality of life. You can see this patient here. There was a lot of weight loss involved, and you can see a lot of the loose skin around it, which poses problems as well when we hemorrhage. So, proper stoma care is essential to maintain hygiene and prevent complications from the urostomy. Managing urostomy appliance involves regular checks and timely changes to ensure comfort and avoid leaks. Regular monitoring for potential complications such as infection is crucial for maintaining health and well-being after surgery. So choosing the right option. The bottom line is you speak with your urologist and determine what will best suit you, your time in life, and what you're able to do. From my perspective, I always encourage people to look forward into what is their life going to look like 10 years, 20 years down the line. We may not be able to have the same dexterity, vision, ability to move, so those are considerations as well. So, the most common urinary diversion is the ileal conduit, or it can be called the urostomy. We use them interchangeably. We call it an ileal conduit because we take a section of the ileum and make it as a conduit for the urine to come to the surface as a stoma. Points to consider. Nutrition and fluid intake. Guess what? You can eat whatever you want and drink whatever you want. There are no limitations, but I do encourage people to drink at least 2 liters of fluid a day at a minimum, and to incorporate fiber into your daily diet. This is important because you want to have daily bowel movements that you're not having to push out, because increasing intrathoracic pressure in your abdomen can cause a hernia if you do it a lot. And even with a urostomy, you are prone to a hernia. Anyone hear of urinary crystals? Urinary crystals can occur if your urine is too acidic. So in order to prevent it, we recommend consuming cranberry juice or cranberry tablets daily. This makes your alkaline urine more acidic. If you're on warfarin or Coumadin, you shouldn't be using a cranberry juice or pills. Incorporating live yogurt into your diet, staying well hydrated by drinking at least 2 liters of water. That dilutes your urine, making it less alkaline. And additionally, proper stoma cleaning and careful application of the pouch will further assist in preventing the development of urinary crystals. So the one thing I didn't say, if you ever do see urinary crystals, in order to dissolve them, you just use a compress of vinegar and water. Because it's acidic, it will dissolve the alkaline crystals. So this is one of the most important things every person with an ileal conduit, even if you have an Indiana pouch or an ileal bladder, is to know and understand what the signs of a urinary infection are. When we have a UTI or a urinary tract infection, most people feel this starting in the urethra. We may have burning, itching, I gotta go pee a lot. If we don't do anything, it'll move into the bladder. We're still kind of safe, but we are still having frequency and burning. If you still ignore it, it'll eventually go to the ureters and to the kidneys, but you have a longer period of time before it can cause damage to your kidneys. Whereas if you see in this diagram, we only have our ureters and the kidneys. So if you do get an infection, it will go to your kidneys quickly. So you do want to be aware of what kind of symptoms that you will feel if you have an infection. The first one that you should know is, oh my God, it smells. If it smells different, the first thing you gotta think of is, do I have an infection? What I suggest to people, or if you have a clear ileal conduit bag, is just look at the clarity of the urine. If the urine is clear yellow, maybe it's something you ate. But if you're starting to see white strands or it's cloudy, you definitely have an infection and you need to go see the doctor to get a urine test done and get on antibiotics. Any questions about any of the symptoms? How to avoid this urinary infection? Drink 2 liters of water daily. That's the third time. This is important. Limit your caffeine and alcohol, as these substances can lead to dehydration and increase the risk of UTIs. How many people use a night bag when they go to bed? So every day you should be ensuring that your night bag are clean thoroughly, and make sure you're emptying the pouch when it reaches a third to a half full. Has anyone had to offer or give a urine sample before? Okay. 1 or 2 piece? 2 piece. So, did you change your pouch? Or did you take it from your urine bag?
We've done both.
A little bit of both. So when we think about it, you want to get the best specimen possible. If you've had a pouch on or the bag has been on for 3, 4, 5 days, I think there's a lot of extraneous bacteria in there. So what we call best practice is changing your pouching system before you go to give a specimen. So you call your doctor, you have an appointment tomorrow. In the morning, you're going to change your ostomy bag so that you have a fresh bag so that you can give a clean catch specimen, as clean as you can. If you're in a 2-piece, you can leave the flange on and clean your stoma and actually put the cup to your stoma and get it directly from the stoma itself, but you'd have to drink a lot of fluid in order to get it to pee when you want it to. So again, changing the pouch would be a good idea. Yes?
When you say cleaning the stoma, you mean the peristoma?
No, actually clean the stoma. Just wipe it with water in order to get a clean catch. You know, when we take a pee and get a clean catch, we need to wash our perineum. Same idea. Just clean the stoma and then pee into the cup. The stoma, yeah. But that's only if you're in a 2-piece and you take off the bag in order to give a specimen. Okay. Do we need a visual? Leo.
So we have our 2-piece. Here's our urostomy pouch over here. And we're looking for, oh, here's our stoma. And so we could clean the stoma itself. And then you could collect the urine from the stoma. And then in terms of the pouch, this is your urostomy pouch. You could remove the drainage tube, and then you could take a sample this way as well.
If the pouch is clean.
If that helps.
Yes.
Very huge this. What is meant by one piece?
Let me show you. So,
I'm
Hi.
sorry.
Jill, please feel free to come and visit the table afterwards, and Joel's table too, but we have one piece, this is a one-piece system which has the barrier attached into the bag. And we have two-piece, which means you've got your barrier, and then you have your pouch that attaches. And of course, we got the colostomy, ileostomy, and the uro-oncology pouch here. So feel free to stop by the table and you can feel it and touch them and try them out.
So I know what you're thinking right now is, what do I choose, a one piece versus a two piece? I put a lot of people into a one piece with a urostomy because you don't have to burp it. There's no chance of it coming apart. And you always drain it from the bottom. Plus a one piece is cheaper if you don't have insurance. So that is something that a lot of people have to consider. A two piece, the benefit of that is it's easy visualization of the stoma and putting it on. And then you have to click on the bag afterwards. It is more expensive. If you have benefits, you're lucky. You can choose either system.
Oh, you have to change.
So when you change a pouch, and I'll avoid it next when it comes up, is 5 to 7 days. I usually try and get a person to wear it for at least 7 days. If you have insurance, you may want to do it more often. If you don't have insurance, I think a week is a nice time. You keep yours on for how long? 10 days? Oh, you're only 6? Okay, okay. So, I mean, there is a variety, and with a good fit, and if you're only getting 3 days, maybe an evaluation by an end swap might be really nice in order to see what else can I do to get a longer wear time. Maybe I need a deep convex as opposed to a convex, or maybe instead of a flat and a ring, I should go to a soft convex. So there are so many products out there that we can play with and trial, and Joel gives free samples, Cleo gives free samples, everyone does in order for you to trial this to find the right product. Any more questions about that? You don't throw me off.
When you say 7 days, you wouldn't actually have the same bag for 7 days.
Yeah. Absolutely. A lot of my people I can fit in for a week with no problem. Yeah. Do you have insurance? You're lucky. Okay, any more questions about how to obtain a specimen?
It's just a quick follow-up question. Should you be telling your doctor and the blood clinic that you have an ostomy, and should they be notified?
Your doctor should be getting notes, and he probably would have sent you if you had bladder cancer. So I'm hoping they do read their notes and know that you have one. If you had an ileostomy, I would definitely tell your pharmacist, because taking medications can be affected with the ileostomy. But with the urostomy, not really.
And if it's a neobladder, it doesn't matter?
If we're doing a nursing history or any kind of history going into emerge, part of that history is talking to you about your urinary system. So hopefully you'll let people know that that is what you have, especially if you go in hospital. If you had an Indiana pouch or a neobladder, I think I'd want to have a bracelet on, because if I was unconscious, knowing I only have 300 mils of volume in my bladder, I would want them to know to catheterize me. Night drainage. This is a special passion of mine, because I know most people aren't told how to properly clean their night bags. After you take it off in the morning, you want to rinse the bag thoroughly with hot water. I know it's hard to put that little tube under the tap. Have your tip syringe, or if you go to Dollarama and get one of those mustard or ketchup bottles with the long nose, it fits in perfectly into the tubing. Put in hot water, shake it around, and then you're going to do 1 part vinegar to 3 parts water, swish it around for about 30 seconds, empty it out, and hang it to dry. I have found that by doing this daily, you can avoid odor for up to 30 days. I recommend changing your bag at least every 30 days, or if it smells. Because again, that's an expense that you have to incur with a urostomy. Also, when you're attaching to your night bag, make sure that you're cleaning your end with rubbing alcohol, and you're cleaning the connector end of the night bag as well. So you do a clean connection with rubbing alcohol. A lot of times when I do see infections, I ask them about night bag care. And a lot of the time, they're not doing it properly, or they're not cleaning the connections with the rubbing alcohol. I have to wonder if there's a correlation. Probably. It's best to do it. I also recommend putting that night bag in a pail or a garbage can, because I have heard there's been leaks on bedroom floors if you don't close it well enough. Oh, you're smiling, Steve.
I've got a waste basket sealed like a, yep,
Yep,
it just prevents anything happening.
yeah. Just once is enough. And I've heard people say it's gone all over the bedroom floor. Care of the pouching system. There's a large range of urostomy pouches available. When I help a person select their pouching system, I do an evaluation of their stoma, of their abdominal skin. Sometimes the one piece is the only thing I can put them in, because of the mechanical coupling may fall in a fold and it may pop. I think of the patient's dexterity. Do they have arthritis? If they have arthritis, will they be able to use a plug on their ostomy bottom, or do I need to go to a valve? And yep, here's the 5 to 7 days. And if you do have a leak, the first manifestation of it is usually itching or burning, because it's that alkaline urine sitting on your skin next to your stoma. And if you learn to recognize that and change the bag immediately, you hopefully will not be wearing your urine. Peristomal skin complications. This is a real thing. A lot of people do get these. What I have seen, the biggest cause is people not measuring their stoma on a regular basis. I've gone in to see people who had their stoma for 20 years and they're still using the same measurement that they came out of hospital with. You can imagine what the skin would look like, because their stoma shrunk a lot. So in every box of product, Joel, do you put stoma measuring tools in all yours?
Yeah.
Okay, so every box should have a stoma measurement guide, and periodically make sure you're the same size. If you're in a pre-cut flange, you can pull off the plastic and put the template over top of your stoma. If you don't see any skin and it's not chafing, you're still in the right size. So the first one, this one is what we call peristomal moisture associated skin damage. This is associated with either poop or pee sitting on the skin under the flange. And because the urine is alkaline, it will eat at the skin, causing skin damage. When this happens, what you would want to do is remeasure your stoma. You have to think, why am I leaking? Am I leaking a lot? Remeasuring is the first thing to do. The second thing for treatment is make sure the hole is right, and then just put a little bit of powder on that open area, dust it off, and put on the new flange. The flanges are made out of hydrocolloid. In the Hollister product, there's ceramide. Ceramide is a component of our skin and it helps promote skin health. With Joel's product, there's actually Medihoney in his hydrocolloid. Medihoney is a natural antimicrobial, and we all know how honey is with our skin, and it's a good product. So these hydrocolloids are a healing dressing, so you don't need to go overboard with skin prep or God knows what. Just powder, put your flange on, make sure the hole is the right size is all you need to do. Okay, so this one here, I'm not really happy with that picture, but this is indicating a yeast infection. Has anyone ever had a yeast infection underneath their flange? No. It is, we all have yeast growing on our skin all the time. It's not about hygiene. It's more about when you're immunocompromised, our body will cause the proliferation of the yeast. Underneath our flange, it's warm, it's moist, it's dark. It's a perfect place for yeast to grow. So what you want to do is make sure, one, your skin is dry and your pouching system is dry after you shower. But if you do think that you do have a yeast infection, you go to the pharmacy, go to the fungal foot section, and get tinactin powder or spray. The spray is like a misted powder. You put it on the affected areas, dust off the excess, change your flange in a couple more days, and usually within a week it's resolved. So if you wanted to, I don't do it. You could put skin prep over top of it, but I never encourage anyone to buy skin prep. I think it's a waste of money. And if you're spending so much money on the Hollister ceramide or the Welland Medihoney, you want to be able to have those products infused directly into the skin. And skin prep or Cavalon is a silicone layer over your skin so nothing will get through it. The last one, this is a dermatitis, so it's an allergy. I've seen that with some products. It could be an adhesive problem around the edges of a flange. I've seen it with someone with chemotherapy. They've gotten the dermatitis. This is the only time that you would ever use a steroid on your skin is if you have a dermatitis. A dermatitis is an inflammation of the skin. This is not dermatitis. This is caused from pee sitting on your skin. This one is dermatitis. It's all over the skin. And this is when you would use something like Flovent. And once it's resolved, you do not use it again, unless it happens again several months down the line. But if it were to happen, I would determine what is causing it. Is it something that I'm using on my skin? Is it the product I'm using? Do I need to trial other products? Should I not use any other accessories on my skin and just stick to water? So you got to kind of work through it. Flovent is actually an inhaler. It is a misted steroid, and it does clear up the dermatitis. But it, like I said, only use it if you have it. Don't use it routinely because your skin will thin and it is not good for you. Any questions? Peristomal hernias. Even with a urostomy, you can get one. 45% of individuals within the first year after stoma surgery will get a hernia. Has anyone ever seen one? You've seen one? Yeah. It can be very disfiguring, right? And do you have pain from it if you let it hang out? No. Sometimes discomfort can happen. Also pouching issues because your body is changing. So what we recommend post-op in Coloplast, I don't know if Hollister does, but Coloplast has a nice outline of post-op exercises to strengthen your core, like Christina was talking about. As we strengthen the core, it'll help prevent the hernia from occurring. Now, if you look at this, you can see the incision. It's through the main muscle of our abdominal wall. And when we increase the intrathoracic pressure, whether you're lifting more than 5 pounds in the first 3 months, or you're lifting up your kid, you have a smoker's cough and you cough, or you have a sneezing fit, some of the intestine will push out beside the stoma. And that's the first incidence of the hernia forming. It'll be firm, and it can grow if it's not managed properly. So if, well, urostomies is going to be permanent. The doctors generally will not fix a hernia unless there is an issue with blockages, twisted intestines. So the best prevention is don't even get one. If you do develop one, the most important thing is to get into a hernia belt. What a hernia belt does is it supports your abdominal wall and keeps that hernia inside. Because if you allow it free range, it's going to grow bigger and bigger. There are a variety of hernia belts out there. Joel with with Premier, he sells Omnibon, which he says is one of his most popular products. Hollister doesn't have one, but there are a variety of them out there. There are some that can cover the stoma, and there are others that have an open hole for the urine to come out. So it's up to you what kind that you're going to use. Now, when you do put on a hernia belt, you want to be in a lying position because that means the hernia has gone in. You strap on that belt, and when you stand up, it's nice and firm and it won't come out. Is that what you do, Steve?
I don't know.
Oh, you don't? Okay. Is that what you do?
Yeah.
Perfect.
You use like a contracted space product instead of.
Absolutely. There are underwear made for that. I know Safe and Simple and I know Premier Ostomy have them. I'm not sure what other vendors have them, but they are out there. Maternity spanks, something like that would also work. But if you're going to go to that expense, I'd go to one that is specifically for stoma. Peristomal care. When we are taught to look after our stomas, if you've had one forever or a long time, or even if you're new, the rules of stoma care has changed so much because the technology of the products that we're using have changed. Like I was saying, Cavalon or skin prep was something that we always used to use. People would always say, you got to crust the skin to protect it. We don't do that anymore. All we want to do is remove the flange with adhesive remover, whether it's spray, whether it's wipes, because you don't want to rip your skin or cause a skin tear. Clean the skin with warm water, a washcloth, gauze, J-cloth, whatever you want. Pat the skin dry. You're going to examine your skin for any open red areas. If there are, you put on your powder, dust off the excess. If you're a guy with lots of hair, what we recommend is a dry shave with ostomy powder. Just put lots of ostomy powder around your stoma, get it big, and shave in the direction of your hair. Measure your stoma to make sure you're the right size. Trim the flange to the right aperture. Don't use any lotions, ointments, iodine, rubbing alcohol, steroidal medications, soap, or anything else you can think of on your skin. You just want water. It keeps the skin in the best health. If you take a shower with your pouch off, soap goes over, it's fine. Don't take the bar and wash it. But if your shampoo goes over, it's fine, just rinse well. Some people choose to use a ring. Put on your flange, pouch. With all of these products and the hydrocolloid, what is really important is to apply heat to the product. Because what the heat does is it melts the hydrocolloid, so it really melts into the skin. Welland or Premier Ostomy and Coloplast, those two particular products, they do work a little bit better if you wear them first. And then put them on and then just have the heat on as well. Heat can be your hand, a heating pad, a hot water bottle, whatever you want. And a belt. I love belts because it'll pop that stoma and get a lot of security. Here's some indicators of how to measure. So as you can see, this one here, you don't see very much skin and it doesn't shave going on. So I would say this is a good fit. This would be a good fit. Look here on the skin. This is not a good fit. I would go to the next size lower or smaller. And you can see over here how nice the body fits. So when you're measuring, that's what you're looking for. So the major brands that we have available in Canada, we have Hollister. You can see what they have. They do have leg bags and neck bags. I do love these ones. These have a little extra juice in it that you can pour right on the flange and it helps to lift it off. All the powders are cellulose, so it really doesn't matter which brand. The belts are different for every appliance. The CeraVe has ceramide in it. This is adhesive remover spray. And then, everyone know what barrier extenders are for? They're not, I like to differentiate what they're for and what you shouldn't think they're for. The flange should or does stick on your skin independently. You should not need any extra adhesive because this is made to stick to your skin. When we use a barrier extender, what I tell people is if you're swimming, you're sweating a lot, you're biking, you're golfing, you're hot tubbing, you may want extra security around the edge of your flange in order so that it doesn't roll and it stays well. Because those are expensive too if you don't have benefits. Coloplast. I wanted to show you with the Hollister, you see that it's a valve. Now, when we look at Coloplast, you can almost see that it's a float that they have. So you plug in the bottom instead of the valve. They also have a leg bag and a neck bag. They use central muse. They have a double pronged belt to hold it on. Their extenders are a little bit different, and they have the adhesive over wipes and spray. Contact is along the same line, but they have a permanent bottle, which you can put out every day. It is about, I think it's a heavy plastic bottle that you can use, but you need to discard the tubing on a regular basis. They also have a plug, as you can see, and they have one with a valve. I just wanted to show you this particular one. They're the only ones with this technology. This is a moldable ring, meaning you don't have to cut it. If you have a regular shape, or let's say your stoma is 23, you know nothing comes in a pre-packed 23. You just open this up and it'll go around the 23 and it'll turtleneck around your stoma, so there's no leakage. Plus, this has we call it an accordion flange, meaning it goes up almost a centimeter to put your fingers underneath. So if you have a hard time clicking, this is nice and easy for clip if you don't have the dexterity in one or two piece. Salts has aloe vera in a product. They have a valve on the bottom of theirs, and they have aloe vera in their rings, their extenders, in their hydrocolate, and they also have hands with elasticity. And they have an interesting thing here. They have a stoma collar. None of the other companies have one. So if you have a stoma that's protruding And the opening is maybe tipped to 9 o'clock and you'll be at 9 o'clock often. This stoma collar has about a centimeter and a half of silicone that will direct the urine forward instead of to the side, so it's pretty cool. Welland, it has the egg honey. They have the large flanges or barrier extenders, they also have micro ones. Their plugs don't require an adapter, you just plug the catheter bag right into the end of here, so there's no connector required. And they do come in 2 different colors, the black and the cement. This is Marlin, they have a valve. But what I really like about Marlin is the way their convexity is. You can see it's in cone shape, so if you have a stoma that's flat or retracted in the middle of the hole, you can just imagine how well something like this will fit into there. So just to wrap up, if you have a urostomy, if you're going to have one, make sure that you are signed up for your ADP. ADP is the check that you get every 6 months for $487. You can get the surgeon to sign it while you are in hospital. If you have 2 stomas, and people do, make sure you have 2 checks coming in every 2 months or every 6 months. I had just met a lady that didn't know that, and a lot of people don't realize that. This is why I'm bringing it up. After 1 year of having a urostomy, you can submit the disability tax credit. It is a T2201, and it is an $8,400 tax credit. And I also learned tonight that you can have it go to your spouse, but I think, did you say you have to do it when you submit?
So if you can't use it, that could be passed on to your spouse as long as they below 12 pregnant.
Okay, are you keeping all your receipts for tax time? If you're paying out of pocket or if you have deductible left, make sure you submit them with your taxes. Have you checked your personal insurance to see if your ostomy supplies are covered? And if you have said no to any of these, please ask me. Just don't let your stoma limit who you are or define who you are. I've met so many people that feel they have to be an isolationist. They don't want to go out in public because, oh my God, I got a stoma. There are so many people out there who have one. Looking at you, I have no idea who has a pouch on or who doesn't. No one knows this. Be happy, live. If you have problems, resources. Joel's company has 2 NSWACs on staff. He's in Montreal. Alba Medical, they have 2 NSWACs on staff. They're in Mississauga. If you're a Hollister person, you reach out to the Hollister Secure Start. They have customer care service there to help you if you're having problems with your stoma. Coloplast, they have it, contact us. Those are resources available to you. If you still don't know what to do, you call Ontario Health at Home and ask for an NSWAC or an ET nurse to come in and see you. Just say you're having a lot of problems with your stoma, your skin is really bad, you need an NSWAC or ET nurse to come in. You don't want a regular nurse because they won't know. You have to ask for us specifically. Thank you.